impact. We provide medical, dental, behavioral health services for over 50,000 patients throughout Alameda County. And we are so proud to be able to do this with cultural competence, with compassion, and with top quality care in 14 languages, of which 12 are of Asian ethnicity. Asian Health Services, during the past 18 months, we have been at ground zero in the midst of a dual pandemic of both COVID and the rise in anti-Asian hate and violence. But we have also been at ground zero in terms of our advocacy, locally, state, and nationally, and the fight back. And so we are so pleased to be addressing these dual pandemics really from a public health framework and lens. And it is with that lens that we are able to care and outreach to our communities, and not only our communities, but also the communities of our brothers and our sisters. And so that is why we are so thankful for our COVID team that is here today, our patients, our frontline workers, our board members, as well as our community-based partners, and to all of you here today, because we know that really it is only together that we can actually be stronger, be safer, and healthier together. And so we are so pleased to have Governor Newsom here today visiting our clinic and entrusting our healthcare teams who have been here since day one of the pandemic, caring for our communities and patients to receive his booster shot. So thank you, Governor Newsom, for really being a model, again, for the importance of boosters and those who are eligible. And lastly, we would just like to thank all of our elected officials who are here today, who have been our very, very strong partners, Supervisor Wilma Chan, Mayor Libby Schaaf, and our newly elected Assemblywoman Mia Bonta. And special thanks to Dr. Mark Galley for his inspirational leadership. We are so thankful for everybody's partnership here today. So it is my distinct pleasure to now introduce our very own Asian Health Services Chief Medical Officer, Dr. Maichi Nguyen.
Thank you, Julia. It's my honor to be here with all of you today. Please welcome our elected officials, our board members, the press, our community, our patients, and especially our staff and community members who are here today. As an internal medicine physician and also the chief medical officer, I would have to say, since shelter in place, our teams and our communities have been very tired. We have fought through many, many hardships in terms of the COVID pandemic, and as the virus and the variants change, I know too that we have changed. As a mother, as a parent, as a wife, as a member where I live and work in the same communities as our patients, I know that we've gone through a lot. Providing culturally competent care and high quality care during a pandemic is difficult. Our goal has been and always been is to keep communities safe. We want to make sure that we do that in addition to providing the culturally competent primary care services in language and in the communities and places where our patients need. As a doctor, I emphasize ways that patients can keep safe. Wear a mask, wash your hands, make sure that you stay home when sick, and most importantly, get vaccinated. It's been an honor and a privilege to be able to vaccinate our communities and our assembly elected officials today. I wanted to say that if you are still hesitating, the vaccines are highly effective and also safe. They have prevent severe illness, hospitalizations, and death. We don't want to see another person succumb to the COVID pandemic if we can help it. With the good news of the boosters that came about last week, we at Asian Health Services, along with our community, has enacted different mobile dispatches and also our clinic to provide the services in language and the vaccinations that our patients truly need. One of the things that I wanted to encourage folks is that if you are eligible for the booster please do so. We're allowing a mix and match strategy and through the CDC, and we wanted to encourage folks that if you have any questions, please talk to your primary care provider to determine which vaccine is best for you. This past year, our communities have entrusted us with their health. We provided over 30,000 shots into arms. Since January 2020, we have been there for our communities through the pandemic, through discrimination, through racism, and with our elected officials to make California, Oakland, and the community a safer place. All this, we are so grateful for the continued leadership of our members, and truly we're all in this together. It is my honor to introduce the next speaker, Mayor Libby Schaaf.
Thank you so much. Your speaking skills are as good as your shot-giving skills. Good morning, Dae Ga Ho. It is such a pleasure to be here at Asian Health Services, one of the incredible treasures of the city of Oakland. And Governor Gavin Newsom, you always give us a boost when you come to Oakland to deliver important information for our public, but also to honor the tireless health heroes that have been on the front lines of this pandemic. And you chose a great place to come today. Asian Health Services has been a trusted provider of comprehensive health to a community that has often been left out. And thanks to your leadership and Dr. Galley's, we have advanced the need to disaggregate data and really understand which communities are being left behind. At the beginning of this pandemic, we all know that so many of our Asian businesses suffered, so many of our Asian elders were afraid to leave their homes. But because of these trusted health providers, we saw high levels of testing, of information, of people that were willing to trust these providers to get the help they needed to stay healthy during this pandemic. It was just weeks after the shutdown that Asian Health Services stood up a testing center in the middle of a public park with 14 different languages spoken to all those who were willing to come and receive a free COVID test and life-saving information. That is the type of heroism that I hope we all tell as we come through this pandemic together. Now today our message is to give Oakland a boost. If you are one of the only roughly 10% of Oaklanders who have not yet gotten at least one vaccination shot, please give your loved ones a boost. Give your community a boost by getting vaccinated. As I was visiting some of the residents who came today to get booster shots, a young man was wearing a shirt with the picture of his aunt who died of COVID. Do not let it be too late for our loved ones. Please get vaccinated. I got my booster today because my work entails a lot of public contact. I'm an emergency responder as your mayor. And so again, if you have any question that you're eligible for a booster, please inquire with your medical provider. The booster felt great. It really did. I feel so good that I'm doing my part to make this community safer. And with that, it is such a pleasure to introduce someone who has been a health champion long before this pandemic. As a legislator, she served as the chair of the Health Committee, and as a county supervisor, she has been on the front lines of Alameda County's very effective COVID response, and that is Supervisor Wilma Chan.
Thank you. I want to really thank the governor for coming here. It's been a long, winding road for this community in terms of the hatred against Asians, as well as just the health of this community. And I want to thank Asian Health Services as well. We have adopted a model in Alameda County of relying on our community clinics, and I am sure that without Asian Health Services, there'd be so many people out there in the community without their vaccines. And that holds true for all our community clinics. They've done a fantastic job. They were one of the first organizations that did testing in this county and had results within one day. So people didn't have to wait for a really long time. So I want to congratulate and thank all the staff who are here. In terms of Alameda County, we're doing pretty well. California as a whole is doing great. I think we're the only state that's not in the red zone, which is thanks to the governor's leadership. That's no small feat because it hasn't been easy. We have a very diverse population with many different kinds of health needs and many different kinds of attitudes towards health. So in Alameda County now, 84% of eligible people are fully vaccinated, 84%. And we have been doing a door-to-door campaign with our private partners. We knocked on 60,000 doors in the last couple months and had 14,000 conversations with people. And we worked in the census tracts with the lowest rates, particularly among Blacks and Latinos. And although we still have a ways to go, 72% of Latinos are now fully vaccinated in Alameda County, which is a big, huge jump. 66% Americans are fully vaccinated. And our highest vaccinated population is Native Americans because of the clinic and because of the work that they did. They're 96% vaccinated. So on the boosters, it's really important for people to get their boosters. Although the shots are very, very effective, their potency does wane a little over time, and we want really everyone to be fully protected. And in Alameda County, we're going to focus on the elderly, that means over 65, and on those with underlying conditions. We'll be working with clinics, but in terms of our own efforts, we're going to be focusing on the older population and those who have underlying conditions. And at this time, we're also getting ready for vaccinating the 5 to 11-year-olds, which we expect to start maybe in about 10 days to 2 weeks. We're going to be partnering with 7 school districts to make sure that this young population gets vaccinated, to protect them and to protect their families. So I'm very happy to be here today. Again, thank you to the governor, to the mayor. And it's now my pleasure to introduce our newest assembly member, though she's not new to health and children's policy, Mia Bonta.
Thank you to Supervisor Chan. I'm Mia Bonta, Assembly Member for this district. I'm so proud that again our governor is here highlighting the incredible work that people in our community have done. Thank you to my new doctor, Dr. Nguyen, who actually administered my booster today. I'm so thankful to be able to support my family and my community in so doing. I just want to encourage us all, if you are eligible to receive the booster, getting a booster shot is the best way to be able to continue to protect yourself, your family, and your community from the COVID-19 and all of its variants. When we talk about needing to be a resilient community, it requires resilient action. And the simplest thing that we can do right now is to go to our trusted providers like Asian Health Services to ensure that we're actually getting our booster. I live with people who are elderly. I have children, and I'm around children all the time who are under 12 years old, and I'm so thankful that they have an opportunity to now get vaccinated as we roll out that vaccination. But as we consider taking care of our communities, it requires every individual to act with resilience. And the best, strongest way to be able to be resilient in this moment right now is to get a booster. So I'm thankful that we're doing that today and that we're highlighting through our governor and his presence here today the importance of doing that. So thank you to Asian Health Services. Thank you to all of the community providers out there who are making us ensure that we can be the most resilient community possible. Thank you. And with that, I get to introduce our honored Governor Newsom.
Thank you. Thank you, Senator. Thank you, all of you, for the privilege of your time, and I'm sorry we had to extend that time with a 15-minute break as we all got our booster shots. But it's great to be here. Asian Health Services, I'm grateful to all the remarkable team here that's been doing extraordinary work, and I appreciate the enthusiasm, particularly that the mayor brings to that work. I can always tell the difference between, well, when politicians mean something, you can always tell the difference. And so I can tell just in the congruency of Mayor Schaaf's enthusiastic support for this community clinic that you guys deliver. And I just want to recognize that and recognize all of you for your extraordinary work and your leadership in the community. Supervisor, those are, I was just whispering to the supervisor, those are remarkable numbers in terms of those that have been fully vaccinated here in Alameda County. And it's just a reminder that any state vision has to be realized at the local level. I say this over and over and over again. Localism is determinative. And so I just want to thank local leadership here at the county level. I want to thank the mayor at the city level for her incredible leadership. And I want to thank our new assembly member for her strong advocacy and support of our health efforts at the state level to make sure that we're supporting these efforts to not only advance the cause of getting more of the unvaccinated vaccinated, but now the cause that unites us here today, and that's encouraging more boosters so that we can address legitimate concerns around waning immunity. Now, I want to be sober about the moment we're in because in many ways it's reminiscent of where we were last year. I want to acknowledge the progress we've made because we should. And I want to thank 40 million Californians for their resilience and for allowing us the privilege of maintaining the lowest case rate, 1 or 2, the first or second lowest case rate in the United States of America for now well over a few months, to continue to lead the nation in terms of a modest transmission rate, to continue to have among the lowest positivity rate, 2.2% today. It was 1.9% a few days ago in America. We have 53.3 million doses of vaccine that has been administered. No one comes close. And we're consistently among the top 10 in terms of doses, first doses that have been provided to our 18-plus population, 88.1% as of this morning. 88% of eligible Californians 18 and over have received at least one dose. So those are nation-leading facts. But it's also a stubborn fact that this time last year we were at 3.3% positivity, 2.2% this year, but 3.3% last year today. Today, we chronicled about 4,000 new cases. Last year, today, it was about 6,000. But I want folks to understand why this is more important than it may appear. We're not just here to promote boosters in an abstract. We're here to promote caution and the imperative of considering getting boosters, particularly if you're in these categories with underlying conditions or your vulnerable population, 65 and over and the like, because of what we anticipate happening this winter, because what we experienced last winter. We have fared extraordinarily well this summer compared to many and most states. But if the past has any instruction to the future, just consider some stubborn facts. This time last year, on the 24th of October, we had about 6,000 cases. 1 month later, we had 18,000 cases. A month after that, 54,000. Basically a tripling of cases every month. That was last year. And we all remember what occurred last winter in December and January. Consider the positivity rate. 3.3% this time last year. It was 6.2% a month later, basically doubled. And then it was 11.9% a month after that, Christmas Eve, doubling again. So a tripling every month of cases last year and a doubling of positivity every month last year. We now have the prospects of a flu season that was substantially mitigated last year because of non-pharmaceutical interventions like mask wearing and social distancing that was practiced at a larger scale than understandably it is this year. And that's why we're also encouraging folks to get the flu shots. You talked about this twindemic. You talked about the stacking of concerns. People will experience flu-like symptoms, not knowing it's COVID, or COVID-like symptoms, not knowing it's the flu. And so I'm here because we have been tracking this very closely. We have been following this data very, very closely. And we had the experience we had last year. And I want folks to know, it's the last thing I want to communicate. I want everyone to say, we all want to be past this pandemic. But we know the ticket out of this pandemic is getting these booster shots and getting the unvaccinated vaccinated. And we still have more work to do. That's why we led and continue to lead the nation in terms of doing that for all eligible students in our K through 12 education system. And that's why we leaned in 5 to 11 once full FDA authorization goes into effect. That's why we led as the first state to require, as a state employer, the largest in the state, to require our own employees to be tested and or vaccinated. And we're just beginning that process, and that process unfolds over the course of months. And I want to remind people of the importance of trying to do the same in the private sector and across the spectrum. This is an incredibly important time, because what tends to happen this time, if it happened last year, is our attention wanes. We start focusing on other things. And as a consequence, we can let our guard down. And so I want everybody to know that we're extraordinarily proud of the work that we have done together in the state and our remarkable resiliency and our nation-leading efforts. We've been led by health, and our economy is among the strongest of any state in America. Just think, last month, 24% of America's jobs once again came out of California, 44% the month before. Those things are directly connected, health and economic recovery. We want our kids back in school without episodic closures. California has outperformed the nation in keeping our kids safely back for in-person instruction because of the social emotional benefits. States that don't follow masking guidance and vaccination efforts have substantially higher school closures than the state of California. 12% of the students, 0.8% of the closures in California. So we have to maintain that discipline, that focus, but we've got to be mindful of the winter months and safely enjoying the holidays together. And I know we all need to spend time with one another. We all need to embrace, and we all need to celebrate each other, because we are all coming out of the trauma associated with this last 18 months. And I know how hard it's been for all of you, everybody here and anyone that may be watching this press conference at home. We'll get through this. We're making progress. We're turning the corner. But let's get these boosters. Let's continue to be vigilant. Let's continue to reach out those that may be on the fence, that may be hesitant about getting a vaccine, encourage them to get a vaccine. All of us are messengers for that in terms of the safety and efficacy. We're proof. We're not asserting something. We're proving that they're safe and effective. And let us continue to lead the way across this nation. And so we're here, again, in the spirit of appreciation, but also respecting that this virus continues to throw us curveballs. And if there's anything, and I'll close with just these final words, that I'm asked all the time, what is the one thing you've learned over the course of the last 18 months? And I repeat it over and over again: humility. We've been humbled by this pandemic, by this disease. What's going on in the UK right now? Always a month or so ahead where we are in the state. We're mindful of what's going on in Israel, nation-leading vaccine efforts, a lot of breakthrough cases. Mindful of that, and I want everybody here in California to be mindful of that as well as we move forward with discipline, focus, and yes, still optimism that we will get through this, and we will. But again, let's not put our guard down. Let's get those booster shots. Let's encourage those that haven't gotten vaccines to get vaccinated. And let's continue to remind ourselves that we're all in this together. And so the spirit that brings me back to Oakland, one of my favorite cities and my favorite region and my favorite state and my favorite country. It's good to be back, and it's good to be with all of you here today. And with that, we're happy to take any questions.
Hi, Governor. I'm over here.
There you are.
We heard some great vaccine rate numbers locally from
Yeah.
Oakland, Alameda County.
Incredible.
But according to the LA Times, the vaccination rate and the testing for state employees, despite the requirement, is lagging behind some of these great numbers we're
Yeah.
hearing. What would you say about that? And could we see what we saw in Washington State, where people are starting to lose their jobs?
All the comments. Look, we were the first state in America to do this. We're the largest employer in California. And we went from 62 to 67% of people getting vaccinated since we put this into effect. That's pretty good progress. Over half people are getting tested, and we're doing something at scale that's never been done. So I like the progress we're making. I like being at 60, almost 67%. I like the fact that some departments are at 90%. And we're still working through telework. People are in person in different categories. But no, I'm confident we'll work together and we'll continue to show the way. And the fact that once the mandate went into effect, which is the case with mandates across the spectrum, that they increase vaccination rates, that the numbers bear fruit to that as well. And so we're just getting rolling.
Follow-up that's sort of related, if you like hamburgers. In-N-Out Burger,
Yeah,
big
I
deal
love
in the Bay
hamburgers.
Area.
In moderation, as I tell my
And
kids.
so what would you say about what In-N-Out Burger has said as
I'm not going to get caught up in the situational issues. In-N-Out Burger is one of our great home-based businesses. I have great respect, admiration. I know the folks at the headquarters at In-N-Out Burger and visited them, and we really appreciate it. A couple years back, you may recall, they doubled down on their commitment to our state, and I want to double down on my commitment to them. At the same time, they have some differences of opinion as it relates to some of these county edicts, and we have to work through them. But you know what? Through this pandemic, there's been thousands of examples like this. Some get highlighted, some don't. In this instance, there's an East Bay chain that there's a little bit more friction and frustration. San Francisco, there was a week or so ago. Other parts of the state, it's not the case. But I encourage everybody to take seriously local health orders, and I encourage everybody to support businesses that support this state. And I appreciate that they're a headquartered California-based company.
Hi, Governor. Matt Bigler, KCBS Radio. I've been asked to ask you about gas prices.
Okay.
They're approaching $5 or over $5 at many Bay Area gas stations. Is there anything the state can do about that? And is this a good opportunity to incentivize the switch to electric vehicles?
Well, we've done that. 2035 will be the first state. You know, we were the first state in the country. I was proud to do this a year ago to require alternative fuel vehicles for purchase here by 2035. We did that. You saw companies like GM, Ford, and others follow suit. We'll be off at COP in Glasgow at the UN Climate Summit, celebrating our nation-leading efforts as it relates to converting from old gas engines to alternative fueled vehicles. No other state in America comes close to our leadership in that space. So that it's a right question in the context of your previous question about gas prices, a way of sustainably getting out of this paradigm, because it's a paradigm that is repeated every single year. There's not an October that I've been governor or lieutenant governor where I haven't heard that question posed. Every time this year, and I don't mean that to be dismissive of it. It's deep anxiety for folks, particularly on fixed income, low income, the cost of gasoline. It tends to be the case around October in particular that we start to see those gas prices rise. Interestingly, later in the year, those gas prices begin to fall back. The specific question I imagine prompted today is prompted by some refinery issues that are more situational that occurred because of the storm a few days ago that may have an impact here in this region. And I'm mindful of that as well. So look, this state, through the leadership of our Attorney General, has looked at price gouging. There's been a lot of investigation in that space. There are a lot of issues around how we can be more competitive from a gas perspective. But I don't think there's anything more important than disabusing ourselves that oil has to be part of our future. It doesn't. This doesn't have to be repeated year in and year out. We should be immune from concerns around what OPEC is doing, what Saudi Arabia is doing, the manipulation of the markets, and the vagaries of oil prices. And we have the technology to do that. We have the know-how to do that. And California's #1 export is electric vehicle. 60 headquarter companies in the state, 34 manufacturing companies. Over half the electric vehicles in this country, or roughly half, are purchased in this state and owned in this state. We're going to accelerate that transition, and you saw that we began that anew last week with setbacks for health and safety, nation-leading efforts at 3,200 feet as well. And I'll be talking again a lot more about that in the UN meeting next week.
Hi, Governor. Melissa Colorado with NBC Bay Area News. Just trying to see if there's any update on the state student vaccine mandate now that more children are going to be eligible very soon. Any talks about perhaps moving that date of July 1st, 2022, maybe earlier? I know Supervisor Wilma-Chan says the county's working with several districts in terms of vaccinating students, but can you give us any update on the student vaccine mandate?
It's status quo ante for now, meaning we led the nation in terms of that announcement. We've been working with 1,000+ school districts up and down the state of California, working with our departments to prepare for this, to work through some of the protocols and some of the concerns that have been expressed in terms of doing this at scale for 6+ million students that have, again, existing vaccine requirements. 10 vaccines have been required to send your kids to public schools for decades and decades. This is nothing new. In fact, I said this when we made the announcement. The most unsurprising announcement related to COVID was the announcement we made to add to that vaccination list a COVID vaccination to keep our kids healthy and safe in our public schools once FDA authorization goes into effect. That has not yet happened, full authorization, not emergency use authorization. Though we saw this week, we're moving in that direction, not just 12+, but obviously 5 to 11. So we're still on that same timeline. That said, and you made this point in reference, and the supervisor's work is demonstrable in this example, we support local efforts to move those deadlines forward. And we have technical assistance teams, and we are continuing to be mindful that there are some communities and some counties and some districts that look forward to moving those dates forward, and we want to be there to support their consideration and their efforts as well.
Governor, this is Carla Marinucci with Politico. Just following up on that question to make sure we understand that some school districts are moving ahead with the mandates faster than the state. For instance, some students are supposed to be vaccinated by next month. So are you worried about operational concerns there? What happens when kids are maybe turned away at the classroom for not having the shot? Just that question.
Yeah, we're working
I'm
through
told
all
this is the last question, by the way.
No, and we have an independent study program that we modified and we've improved, working through the legislative process to improve the independent study program. This mandate's only for in-person instruction. It has a personal beliefs exemption, has a religious belief exemption. It needs to be remind parents of that. There are 10 other vaccinations that your kids get for measles, mumps, rubella, whooping cough. I find it rather just extraordinary and fascinating, some of these politicians out there that are just outraged that somehow their freedom has been impacted, yet they're doing nothing about their previous mandates that they are accountable for on all those other vaccines. It's rather curious to pick and choose. This pandemic is one that doesn't seem to concern them as much as these others that go back a century. The politics around this is disturbing to me. Lives are quite literally at risk. I found there was a politician that wants to recruit police officers, which they've died 5 times. A rate, they've died to COVID, and they've died to gunfire, and yet they're claiming to be champions of law enforcement. If you're a champion of law enforcement, you support getting vaccinations. There's a lot of politics in this place. And when you are leaders of states that require close to 12 vaccines already for your kids, but you choose to not require this one, I think, humbly, you're playing politics, particularly with the pandemic. It's taken millions and millions of lives and continues to ravish this nation and our economy and our ability to safely keep our kids back in school and get them educated. It's a rather curious moment in American history. And so we'll keep our focus on encouraging people to get boosters, get vaccinated, keep our kids safe and healthy. We had a Western States Advisory Committee. Again, we double down here on science and health. We don't just listen to the FDA and others. We actually have a Western States Advisory Committee that looked at the data that came out of the FDA. We're in partnership with many other Western states, not just California-based advisory group, that unanimously recommends the boosters, that's supporting our efforts to get our kids vaccinated as well. And so we're doing so thoughtfully, and we'll continue to be mindful, Carla, of your question, and I'll close on this as it was the last question, that it's iterative. Yes, we're always concerned about the process and the application. And, process seems to be our obsession right now in Washington, D.C. around the reconciliation process. And it's stubborn, it's hard. I'm not going to suggest otherwise. When you have 1,000+ independently elected school boards in the state, or districts rather, and independent school boards and mayors and county supervisors and north, south, east, west, strong ideological leanings, it's hard to apply at scale when you're the size of 21 states combined. And so when people lead, they have natural friction. There's a dialectic there. But there's lessons learned in that process. And this is a long response to your question as I close. That when LA moved, San Francisco made some announcements, and then they pulled back a little bit. Oakland then doubled down and really locked in. Lessons are learned in that process. And we have advisory teams, we have technical teams. Dr. Galley meets with these folks consistently, and we're able to share those best practices, share those concerns, and work through those considerations. And again, I'm gonna, Doctor, you're the pediatrician, not just our Dr. Fauci, and maybe you can just close up by walking through, because it's a really good question that was asked about the schools, and I want to just close this out. I know we're all mindful of everybody's time, but this notion of that technical experience and the best practices that you're sharing, I think is really important to highlight how we're working with folks very, very closely up and down the state.
Thanks, Governor, and great. Thank you for hosting us here at this tremendous health center that has meant so much to this city and to the populations it serves. It's a privilege to be here. Thanks for the questions on schools. And on the heels of the FDA's announcement around 5 to 11, anticipating 1.2 million doses of the 5 to 11 formulation of the Pfizer vaccine available in our state in just a handful of days, anticipating starting that rollout next week. Governor, you're right. The work with school districts has been tremendous. By the middle of the month, thousands of partnerships pursued across the state to set up vaccine clinics on the campuses in order to, A, get kids, young people, not just 5 to 11, those 12 to 17, still working hard to get that population vaccinated, and not just the kids, the adults that take care of them, those caregivers, those grandparents who may need to do what you did today, Governor, get boosted for a number of different reasons. So we're really interested and excited about that. And one thing that I think gets lost in this message, I think a lot of parents wonder, well, why? COVID hasn't affected kids as much. The truth is COVID has caused more deaths. It's among the top 10 killers of kids in the last year. CDC announced it as the 8th leading killer of young people. So this is not just another thing for kids to take the hit, take one for the team. This is about protecting kids, prioritizing kids, keeping schools going, keeping schools safe, getting back to normal. So as a pediatrician, father of 4, Governor, I know you're a father of 4, we have a real obligation to highlight that this is about our kids, not about the adults. Yes, there's the benefit of protecting the families, making sure that abuela is protected in a way when she or grandpa might have an underlying condition and at risk. But this is really about protecting our kids. And that technical assistance, Governor, that you mentioned is working with school districts, local health jurisdictions to get the message out about how important these pediatric vaccines are. They are safe, they are effective. The formulation that came out that is 1/3 the dose, 0.10, not 0.3, for the Pfizer vaccine has been shown to create the kind of immune response we want to see in terms of protection and create the kind of risk profile that people are comfortable with. And that is not just endorsed by the FDA. Next week we'll see it through the CDC, hopefully the same outcome. And then immediately, like you said, Governor, our own Western states, some of the leading immunization experts, not just in California, not just in the nation, but across the globe, debating what we should do here, and I expect endorsing exactly what we see, that these are safe. So the work we're doing with our schools, with parents, with pediatricians, family practitioners, clinics like this one, to spread that news that this is about prioritizing kids, This is about protecting young people, I think is key. 9% of the state's population is 5 to 11. Do you know what that means? That means adding 9% more to that blanket of protection that has helped lead the nation in terms of vaccine rates, lead the nation in terms of transmission, and helping us get through what the governor identified is a period of time in the next weeks and months where we can't have history repeat itself. We still have so many unvaccinated Californians, kids as well, new variants, new concerns about infectiousness and transmissibility that we need to keep our guard up, and getting young people vaccinated is part of that story. So it's a real privilege to work with all the communities, all the school districts, our local health jurisdictions that are working hard to make sure not only are we ready, but that we're getting the message out about how important this is.